GLP-1 medications have been quite the rage over the past few years and continue to dominate headlines. However, not everyone has access to these medications. Hi, I'm Dr. Esra Shermadou. I'm board-certified family medicine and obesity medicine physician. And today we're revisiting some older but still effective weight loss medications you may have not heard much about. Before GLP-1s like Wegovy and Zepbound took center stage, there were other medications used to help with weight management. While GLP-1s can lead to the greatest weight loss, they're not for everyone. They can be expensive, hard to tolerate, or simply not accessible. These non-GLP-1 medications didn't get much attention until recently, in part because obesity wasn't widely accepted as the complex chronic disease it truly is. Genetics, behavior, environment, medical conditions, and even medications all play a role. It's not just about willpower. Today, we're breaking down 4 older but still important tools in the anti-obesity medication toolbox. We'll be discussing Phentermine, Orlistat, Qsymia, and Contrave. Phentermine is one of the oldest and still most prescribed weight loss medications in the US, approved for ages 17 and older. It's a stimulant, so kind of like caffeine, but stronger. So it stimulates the central nervous system, reducing appetite and slightly boosting metabolism. Originally, it was approved for short-term use only, about 12 weeks at a time, but studies show that it can be used for longer periods, especially in those who are low risk for cardiovascular disease. Studies show that Phentermine can lead to about 6% weight loss over a few months. Side effects include dry mouth, insomnia, jitteriness, and a faster heart rate. It's not recommended if you have high blood pressure, heart conditions, or a history of substance use. And while it may help jumpstart weight loss, it's rarely used long-term on its own. Orlistat is another medication sometimes used for weight loss and maintenance. It's also known by the brand names Xenical or Alli. It works by blocking fat absorption in your intestines and is taken 3 times a day with meals. Orlistat inhibits the breakdown and therefore absorption of about 30% of ingested dietary fat. That might sound helpful, but it can lead to unwanted side effects like oily stools, gas, and sometimes frequent and urgent bowel movements. Eating meals with less fat can help mitigate this, but it can still be difficult to tolerate, especially if you have to work or go to school. Because it blocks fat absorption, it can also interfere with how your body absorbs certain key vitamins, specifically vitamins A, D, E, and K. Taking a multivitamin that contains these vitamins is important so that you're not losing out on these nutrients. On average, weight loss with Orlistat is around 3 to 5% over a year, but it's also been shown to reduce the risk of diabetes and improve cholesterol levels. Some people tolerate it well with a lower fat diet. For others, however, the side effects are just a deal breaker. Qsymia is a combination of Phentermine, which we previously discussed, and another medication called topiramate. Topiramate was originally used for seizure and migraine management, but it was found to have side effects of decreased appetite and weight loss. Because obesity has many root causes, the idea behind combining these medications is to target multiple pathways at once, leading to better results with fewer side effects. Together, Phentermine and topiramate reduce appetite and cravings, making this one of the most effective oral medications for weight loss. In trials, people lost 9 to 10% of their body weight on average. But it's not without risks. Side effects can include tingling, mood changes, dry mouth, and insomnia. And because topiramate is linked to birth defects, women of childbearing age need reliable contraception and careful monitoring. The 4th and last medication we will discuss today is Contrave, which is a combination of bupropion, a commonly used antidepressant and smoking cessation aid, and naltrexone, which blocks opioid receptors. Contrave works in the brain to reduce cravings and emotional eating. Patients typically lose 5 to 9% of their weight. One trial, the Core BMOD study, showed that when paired with behavioral support, over 66% of users lost at least 5% of their starting weight. Contrave was also shown to improve HDL cholesterol, which is our good cholesterol, and triglyceride levels. Common side effects include nausea, vomiting, dry mouth, insomnia, and headache. Contrave can be especially helpful if emotional or stress eating is part of your pattern, but it cannot be taken if you have a history of seizures, high blood pressure, certain eating disorders, or if you are currently taking opioids. Every medication we've talked about today has a place and may work better for one person than another. They aren't magic, but they are tools. And with expert guidance and lifestyle changes, they can help you move forward in your journey. If you're feeling stuck, you're not alone, and you don't have to stay stuck. These medications aren't shortcuts, but they can be effective tools when used with the right support. So talk to your doctor if any of these options might be right for you. Share this with a friend who's struggling, and if you're in the Dayton, Ohio area, I'd love to help you achieve your health and lifestyle goals. Check out my practice, sakinahealth.com. The link is in the description below. At Sakina Health, we tailor your care to you, your body, your goals, and your life. Thanks for watching, and next week we will be exploring the newer class of weight loss medications, the GLP-1 injectables, and newer ones to come as well. And if you're ready for personalized, shame-free care, make sure you check out sakinahealth.com to sign up to our priority list so that you know when we start accepting patients. That's it for now, and we will see you next week.